Dr. Barry Pakes, York Region's Medical Officer of Health, joins 1059 The Region this hour. Dr. Pakes, what can you tell us about National Kids and Vaccine Day? That's today, isn't it?
Yes, it is. Just a great opportunity to have some more discussions about vaccination in kids. Obviously, specifically, the COVID vaccine is the one folks are most thinking about. And the organizations that put this day together have offered a number of town halls. We've done so as well and tried to communicate to parents, but this is yet another way that parents who are looking for further information about COVID vaccines can receive that from a expert third party group and then hopefully make the right decisions on vaccination.
And what are the benefits of the COVID-19 vaccination for children 5 plus?
So, the simplest one, of course, is that it protects you from COVID. And it really does protect very well. And certainly with Omicron being a new variant that came into being really after these vaccines were first studied, we're only now accumulating enough information to tell us really how protective it is. Certainly, when the studies were initially done, it showed that it was, exceptionally protective against Delta variant. And now we're seeing that it's very protective against Omicron, specifically against admission to hospital. So really, with Omicron overall, we're focused on hospital, acute care, and severe illness because we know many, many people, including children, are going to get infected. But what the vaccine does is it really prevents severe infection. That includes hospitalization, potentially long COVID symptoms, and even death, which is very rare in children, but certainly it's possible that it occurs. So the vaccine is exceptionally effective, and we know that it's very safe. It's, tens of millions of doses now over the past couple of months have been delivered, 1.5 million here in Canada and about 600,000 plus in Ontario, and we know it's exceptionally safe. And I believe, according to the last Public Health Ontario report that I looked at, there had been only one adverse event or a one severe response out of all those 615,000 until sometime last week. So, all of the numbers are looking great, and the benefit is just really overwhelming, not only in terms of preventing against serious illness, but this overall picture of allowing kids to go back to being kids. And that doesn't just include safe return to school, but very shortly, hopefully, it really will allow them to engage in extracurriculars and other social events in a way that everybody, them and their parents and families, can feel much more comfortable.
Dr. Pakes, though, what do you want to say to those parents who are still reluctant? I know you mentioned that millions of doses have been delivered, but there are still those parents who are hesitant about vaccinating their children, 5 to 11-year-olds or 12 plus, because the vaccine just hasn't been around that long. What is your message to them?
Sure, it's understandable. Certainly, it certainly was very understandable right at the beginning. I think, when it comes to the 12 to 17 group, they're up over 90% or at 90% of first doses and around 87, 88% in second doses. So really that's at or above in the general population. So, parents of kids in that age group have certainly made that decision to get those kids vaccinated. One of the reasons, of course, is that they need to present proof of vaccination, and that was a great motivator. But for parents of younger kids, we get our kids vaccinated for all kinds of things all the time. And I think, if you look at the data, on the one hand, while this is somewhat a new vaccine, it's also a better studied vaccine than almost anything else. If you look planet-wide, 10 billion doses of a variety of vaccines, but including a large percentage of these mRNA vaccines. And we've really seen, very few meaningful safety signals. Certainly, as I mentioned, very, very few or none at all really in kids. And it really just, if you look at the benefits and harms, it's all benefit and almost imperceptible potential harm. It's understandable to be questioning it, but now that we're 2 months in, I think the best way to frame it, because I imagine most parents have given a good deal of thought, certainly the ones that are hesitant have given a good deal of thought, and I really think it's best just to look to the people who are vaccinating first. And certainly, as a physician who's involved, and I've got a bunch of kids, and I certainly went out there and got them vaccinated right away, and as did all of the physician colleagues that I'm aware of, really in the first couple of days. That's the degree of confidence that I have and that, we as a collective have. And I think it is all about the stories that people tell. And I think that confidence hopefully will have parents vaccinate their kids. Now that in York Region, we're at 60% or just below 60% of kids. And, really looking forward to getting that other, 30 or 40% of parents we know are enthusiastic, but not quite there yet. That's where we're aiming really in the next 2 weeks.
For those who are not vaccinated or not boosted, are there walk-in appointments available across your region?
Yes, absolutely. And there are lots of appointments that we've designated as available for kids right through, but including right now. And we know from our bookings that kids tend to like to come after school, which makes sense. They don't want to miss school in order to get the vaccine, but they are open in the evenings. Most of the clinics up until 7 and some longer. And you can either just walk into a clinic or you can book an appointment. And all of the York Region clinics for kids, first and second dose, are walk-in. We prefer you make an appointment if it's going to be for a booster. But if you do walk in with a booster, we'll see you anyway. And actually, news on that front is that both Pfizer and Moderna are going to be available for the boosters. I know this is mostly about kids, but we have only had Moderna for a while, which, to be honest, is probably the better vaccine to be boosted with. But we know some people really prefer Pfizer because they had it before and they want it again. And we're now making that available as of tomorrow and certainly more by Monday as that provincial supply comes through. So, really good news on all fronts.
Absolutely. And thank you for covering all of the bases with us here at 1059 The Region. Dr. Pakes, we appreciate your time.